Well, joining us, Dr. Veer Pushpak Gupta, National Health Service of the United Kingdom. He's a COVID-19 doctor who's been involved in research for recovery trial in the UK and member of the Royal Society of Medicine. We're also being joined by Dr. Angelique Coetzee, chairperson of the South African Medical Association. Thank you both for being with us. Dr. Veer Pushpak Gupta, to you first, daily UK COVID cases now surging by 47%. What, in your opinion, has led to this sudden and staggering jump?
Yes, thank you for having me on the show, Ankita. I don't think it's been a sudden jump, to be honest. I think the world is just a little bit more involved with other issues going on around Europe at the moment, but actually it's been going up steadily. And if you look at the numbers that you've just shown in Europe and the numbers that you've shown in Southeast Asia, it's been a steady rise for the last month or so. We've had news from Israel that there's been a new variant that has been discovered known as the B2 variant. And that's actually a very concerning one because it's the most transmissible variant until now that we have seen. The research that has come out of Israel shows that the original R number of the COVID virus when it first came out 2 years ago was 2.5. The R number of this new variant is 12. So it's about six times more transmissible than the original variant that first came out in 2019. So things have been happening on the COVID front, and we've seen this in the past that when things flare up in Southeast Asia and in Europe, inevitably in about a couple of months, other countries around the world seem to see the effect. And I think the advent of a new variant, the coming out of a new variant, as well as China, South Korea, and Vietnam having increased numbers is making a difference.
2 weeks ago, the UK actually dropped its last remaining COVID-19 mitigation measure, which was the requirement that people who test positive for the virus isolate for 5 days. Do you see that as one of the factors that could have led to rising cases and hospitalizations again?
Yes, possibly. I think the last numbers that we got was that about 90% of the population had about 2 doses already of the vaccine, and about 70% had gotten their booster jab as well. And since those numbers have come out, I think there's been a lapse from the authorities in terms of the measures that are there. And that could have led to an increase. But I think it's important to see how many people have the antibodies and how they can fight the virus. As long as the NHS is not being overwhelmed by this, I think numbers are still under control. But when we see more and more symptoms and hospitalizations, that's when the problem occurs. So we'll have to wait and see how these measures turn out. But at the moment, I think numbers are going up, and that's reality we have to face.
Would you say that there could be at all a scenario where the UK could revert back to some restrictions, or is that very unlikely at this point? Dr. Gupta.
It's quite tough to say that. I think the government was quite categorical when they removed these restrictions, knowing that the numbers were improving and there were not as many hospital admissions being seen, especially in terms of deaths and severe disease. But if that changes, I think the government will have to take notice. It's important to also note that we're seeing a lot of secondary admissions now due to long COVID. I mean, I'm in practice every day, and I see a lot of patients that have suffered from long COVID symptoms, whether it is depression, anxiety, heart problems or breathing problems. So that's also an issue that we're dealing with, plus all the cancer cases and the operations that were elective that have been delayed. So health systems are being affected in a lot of different ways due to what happened in the last 2 years. And we wouldn't want that scenario to repeat.
Yeah. Dr. Coetzee, has that been your experience also in South Africa, that it's long COVID or other associated ailments that are really seeing a recurrence in hospitalizations rather than the COVID infection alone?
I agree with Dr. Gupta here. So the Omicron, whether it's B1 or B2, our hospital admissions related to only COVID-19 are not really increasing. We've got a bigger problem with patients that never came to the surgeries to be treated for their non-communicable diseases before. So the blood pressure is uncontrolled, sugar are uncontrolled, and then leading then to a secondary catastrophe with heart attacks or comas or which could have easily been prevented if they attended the doctors as they should have, as in the past. So that's a bigger problem. And yes, I would like to also agree with Dr. Gupta around the emotional impact So there's two ways there's two major reasons for this. One is long COVID, especially after the Delta wave that we have seen, the Delta wave, and there's nice data as well that suggests that Delta also gives you brain, problems going forward. But due to strict lockdowns, and the economies of countries, that is not where it's supposed to be, the poor state, that also leads to a lot of anxiety. So it's a double whammy on patients currently.
Right. Dr. Gupta, one last quick question. Would it be safe to assume that the United Kingdom is offering all of us in India a preview of what we could see perhaps play out in a few weeks, a month perhaps?
It's possible, Ankita. I think also the important thing to note is that there's a lot of research going on now in terms of treatments. The UK has just come out with the first medication that can prevent COVID symptoms, and it was released by AstraZeneca. It's now available in the NHS, and it's shown to have reduced the severity of COVID symptoms by 70% in those who take it prophylactically. And I think so as our medications improve, as our vaccination numbers obviously keep improving, I think we will still be able to fight this disease off adequately, but we just have to be cautious. And I think all options should be on the table by the government.
All right. Thank you both very much indeed, Dr. Gupta and Dr. Coetzee, for being with us on this program.